Hello, everybody. This is Nursing Reviews, where we cover nursing concepts in under 5 minutes and on one page. Today, we are going to be taking a look at mean arterial pressure, or MAP, or sometimes referred to as MAP. I think this is something that is commonly misunderstood, but definitely essential to nursing practice. So this is a cardiovascular physiology parameter that is often measured and used in ambulatory and inpatient settings. So MAP or MAP represents the average arterial pressure during systole and diastole. So during the complete cardiac cycle, this is going to be the average pressure when the heart is squeezing during systole and relaxing during diastole. It is estimated using several different formulas. The one that I think is the easiest to remember is the 1-2-3 method. So you have the systolic blood pressure one time plus the diastolic blood pressure times 2. So 2 diastolic blood pressures, and then divide that by 3. So 1, 2, and 3, and that is going to give you an estimate of your MAP. A perfect blood pressure of 120/80 has a MAP of 93, and this is the number in the parentheses, typically after the blood pressure that you've seen on the monitor in your clinicals. So a normal MAP is roughly 70 to 100. In the hospitals, typically over 65 is used as the minimum target. If you've seen in the ICU, they'll commonly say titrate the levofed or norepinephrine to a MAP of greater than 65 at minimum. So this is essentially useful in settings where continuous blood pressure monitoring is not available, and you want to know or estimate just how much perfusion your patient is getting. MAP is affected by primarily 2 factors: your cardiac output and your SVR, which is systemic vascular resistance. Cardiac output, as you'll recall, is heart rate times stroke volume. Stroke volume is influenced by ventricular cardiac contractibility or ionotropy and preload. So preload depends on the venous return of blood to the heart. So an increase in blood volume enhances the preload and therefore increases the stroke volume and cardiac output. Afterload, as you'll recall, is the resistance that the heart muscle must overcome to eject blood from the left ventricle to the body. It is inversely related to stroke volume, so a higher afterload is going to reduce stroke volume because you have more resistance that the heart has to pump against. SVR, or systemic vascular resistance, is primarily determined by the constriction or dilation of the arteries, or the arterioles as they're called when they get smaller as they go down to the tissues. So vasoconstriction is going to decrease the radius of the arteries and increase the resistance that the heart has to pump against and therefore raise blood pressure. Vasodilation is going to increase the radius and decreases the resistance that the heart has to pump against. Blood viscosity also affects SVR. Higher hematocrit levels, of course, tell you how viscous the blood is, and states like dehydration. But mainly the dilation and constriction of the arteries is what's going to affect SVR the most. So why do we care about MAP and why do we use it? So maintaining an adequate MAP is vital for ensuring sufficient tissue perfusion. That is what we are monitoring here. So you need at least about 60 to 65. In my clinical experience, 65 is the minimum that we need to make sure that the organs are getting perfused. Deviations from a normal MAP can cause organ dysfunction. So hypotension is kind of the more dangerous side that you've probably seen. So this can lead to inadequate organ perfusion, leading to ischemia when there is not enough blood supply to meet the tissue demands, and potential organ failure. So a very popular test question for the nursing programs are: what is the earliest and the best indicator of overall organ perfusion? And the answer is typically urine output. Specifically, a decrease in urine output would mean that you are not getting enough blood to those tissues, to those organs to function. Inversely, on the other hand, hypertension or having a high MAP increases the workload of the heart and can cause damage to the blood vessels. It can cause things like left ventricular hypertrophy or an increase in heart muscle size, which can lead to heart failure. Things like atherosclerosis, which is the plaque formation from lipids and damage to the blood vessels, and end organ damage from high blood pressure. I will be reviewing hypertensive urgency versus emergency in later videos, but that is kind of a parameter for MAP as well. So hopefully this has helped you understand a little bit more about MAP. If you have any suggestions for me, let me know in the comments, and I can consider making a video about topics that you have questions about. Thanks so much.